Hello guys, so once again a blessed and also wonderful day to everyone. So this is just again a recorded version of our continuation in stem cell therapy. For the information of everyone, when it comes to that of the remaining items, specifically in the review in cytogenetics, I will be uploading that one tomorrow, which is on Sunday, together with some information about your recalls when it comes to that of your patterns of inheritance and of course hybridization. Now let's now continue with this one. In this part, if you are to remember, we ended on the topic about your xenogenic transplantation of stem cells. Guys, for this time, the question is, how does stem cell therapy work? So for the information of everyone, stem cells can be used to generate healthy and functional type of specialized cells which can then replace diseased or dysfunctional cells. For the information of everyone, this is more of the term known as regeneration. Or at times, it can also be creation if ever we are talking about the whole organ itself. Why regeneration? Remember, in this case, some cells have already died. Some tissues have already been fibrotic. Some tissues have already undergone necrosis. Some have infarcted. When we speak of our regeneration refers to that specific status wherein the cells will be revived, and that specific area which is supposed to be an infarcted or dead area, if you are to remember, no, infarcted with fibrous tissue also, okay, that has undergone fibrosis, will be regenerated and will now be reformed as if it is anew. Guys, for the information of everyone, hindi anew na A, tapos space N-E-W. No, anew. Bago wala, A-N-E-W. Next one, for the information of everyone, it can be creation in a sense that we are forming a new organ. So let's say, for example, that specific stem cell here will be formed into a heart organ. Of course, in this case, that may be creation and it may simulate the work of God. It is similar to the process of organ transplantation, only the treatment consists of transplanting cells instead of organs. If you are to remember, in organ transplantation, it's mostly guys organ. Okay? But at times it can be tissues. But most of the times, guys, when it comes to that of our cell therapy, it's just again the transplantation of cells. These cells are once again multipotent multipotent or pluripotent, and of course, as they are inserted or administered or injected into a certain site, regrowth and of course that specific proliferation of cells will happen. And actually, this is well explained in the next slide, wherein in the next slide, we have here a certain principle that talks about, yes, adult stem cell therapy. Okay, so if here there's a certain example that can be also explained by that of the next slide, but actually we're going to explain this one as is. So for the information of everyone, when it comes to that of our adult stem cells, the source may be the patient himself or herself, or it comes from any other donor. In this case, let's say for example, this is the patient which serves as the donor of the same stem cell. Okay, let's say, let us somehow assume that this patient has leukemia. So this patient has that specific problem in the proliferation of WBCs. So may problem siya guys in the proliferation of WBCs. If you are to remember, it can be acute lymphocytic leukemia, chronic lymphocytic leukemia, acute myelogenous leukemia, or chronic myelogenous leukemia. Those specific types of, let's say, for example, leukemias that are somehow dreaded by that of the students because there are so many things to memorize. Okay, let's just again remember it's leukemia. We have here a certain type of bone marrow that continuously produces, please take note of this one guys, that specific cell WBC in numbers that are over and above that of the usual. And guys, these cells are non-functional at the same time. So the sample of bone marrow or stem cells are harvested from this specific patient. Let's say this patient contains leukemic cells. Let us somehow assume it's 80% abnormal, which means leukemic cells, and 20% normal. So we have somehow harvested that specific set of cells with 80% abnormal cells and 20% normal cells. So what happens now? Guys, this one will be harvested and will be processed in the lab. This will be treated with agents that will destroy your leukemic cells and will only retain those stem cells that are usually considered as normal. So let's say, for example, we have here specificities. In this specific form, there is a specific characteristic of this medication or of course chemotherapeutic agent that will kill only the abnormal cells and will retain the normal cells. So what will happen now? Guys, before this is administered to that of the patient, guys, the patient's remaining bone marrow and leukemic cells will be destroyed by this specific process known as chemotherapy plus radiation. So with the use of chemotherapy and radiation, take note, all the remaining marrow cells will be destroyed. So what happens now? There is now the nullity, nullity of that specific bone marrow. So the bone marrow now is null. Okay? Which means the bone marrow itself is said to be somehow filled only, let's say for example, with your lipid-juice fatty marrow, but not anymore the cell regenerating marrow. So this is now null. For the information of everyone, we did the chemotherapy and radiation in order to completely remove all of those leukemic cells and even, guys, those normal marrow cells. So what happens now? If you are to remember, we have here the collection of approximately 20% normal marrow stem cells, and they are all normal because all other 80% abnormal cells were already, once again, deleted or destroyed with the use of this agent. So what happens now? This bone marrow or stem cells now, which are once again, as what was stated, guys, as what was stated, normal, only normal was left, will now be injected into the same patient, which is also considered as the donor. For your information, because it is now injected with that of, please take note, normal bone marrow cells or normal stem cells, only the normal bone marrow cells or stem cells will proliferate and will now produce all other cells depending on their own progenitors if they are under the myeloid stage or the lymphoid stage. So in this case, guys, the patient here becomes the donor of the normal marrow, only that if you are to remember, firstly, you need to remove the leukemic cells in order to harvest only the normal cells. Guys, this can also happen if the donor comes from that of any other individual. In this case, guys, still the patient's bone marrow together with that of leukemic cells will be destroyed. They destroy vegetative so that only the normal cells will be left behind. And of course, guys, remember the patient here will receive the bone marrow or stem cells that is now somehow composed of normally producing cells or proliferating cells that will generate all other differentiated cells in the future. Take note, guys, sir, is there still a treatment for that of the bone marrow or stem cells collected from that of a certain donor that is not the patient himself or herself? Yes, this is also requiring treatment still because we could not again completely nullify the fact that the patient, or sorry, the donor rather, may also have some, let's say for example, neoplastic cells in his or her marrow. That's the reason why, to completely negate that specific probability, we're going to treat it still with a certain set of medications or agents that will inhibit the growth of your abnormal leukemic cells. Okay? So this is what actually happens here. So in bone marrow transplants, so guys, please remember this one, that there is a writings first. In bone marrow transplants are considered as an example of cell therapy. If you are to remember multipotent cells from adults, in which the stem cells in the donor's bone marrow are used to replace the blood cells of the victims of leukemia. So this replacement of that previously abnormal leukemic cells with normal cells will now again somehow regenerate the person's own myeloid and lymphoid progenitors to produce those specific end cells, or if you are to remember, regenerated, differentiated cells that are again normal. Cell therapy is also being used in experiments to graft new skin cells to treat serious burn victims and to grow new corneas for that the sight impaired. So if you are to remember, it is also used for graft new skin cells, or to graft new skin cells, specifically for those individuals who have suffered from third-degree burns, and of course to grow new corneas. Remember, as what was stated, guys, we can form a specific tissue or organ with the use of stem cell therapy. In all of these uses, the goal is for healthy cells to become integrated into the body and to begin to function like the patient's own cells. So that is once again the gist of why we do stem cell therapy. Next one. What diseases can now be cured by stem cell therapies? So we have here, guys, as what was stated, if you are to remember in stem cell therapy, regeneration of any tissue, we have here multipotency and also pluripotency. If it's pluripotency, almost all of the tissues or organs of the body can be addressed or reformed. So any disease in which there is tissue degeneration can be a potential candidate for that of stem cell therapies. Example, corneal degeneration. Example, guys, we have here heart degeneration, liver degeneration. So any tissue that has undergone degeneration can be treated by such, because the injection or administration of a new tissue will again regenerate that specific organ, revitalize that specific organ, and energize that specific organ. So we have here the major progress in several important health problems associated with stem cell therapy. Guys, one of this is said to be your Alzheimer's disease. If you are to remember, guys, when it comes to the Alzheimer's disease, usually this happens to those individuals who are again greater than 60 years of age. And for those individuals who have had that specific brain, we may say damage, or of course even some concussions that can lead to that of a certain forgetfulness and inability to properly organize his or her activities. Next one, guys, we also have here the pill rolling disease, also known as the Parkinson's disease, with improper and of course, guys, non-directed tics or of course movements. So this is your Parkinson's disease, and it is also treated by such. Next one, spinal cord injury. Remember, guys, one of the most difficult, we may say, injuries that one may suffer from, and of course very difficult to treat, is your spinal cord injury. And guys, when it comes to that of stem cell therapy, just a certain administration or injection of that specific stem cell, which will generate another spinal cord cell, if you are to remember this specific type of disease or of course degeneration, can be addressed. Remember, anything that has undergone damage, degeneration, and even inflammation can be treated. Heart disease, if you are to remember myocardial infarction, even the infarcted tissues can be regrowth or of course regrown. Let us now continue with that. The next one we have here can be regrown on term. Severe burns, if you are to remember, for that of grafting, we can also make use of your stem cells coming from the skin. And even, guys, one of the most difficult to treat, if you are to remember, the metabolic disease that will be accompanied by several complications, your diabetes mellitus. So all of this can be somehow treated with the use of your stem cell therapy. Remember, metabolic diseases, also, guys, those degenerating diseases, also, guys, injuries, and even, yes, acute and of course, as we may say, chronic acquired conditions can also be treated with this specific type of therapy. Next one, Alzheimer's disease, and can stem cells help? Okay, guys, remember Alzheimer's. Stem cells could, however, be genetically modified so as to deliver substances to the Alzheimer brain to stop the cells from dying and stimulate the function of existing cells. If you are to remember, in Alzheimer's disease, forgetfulness happens because of neuronal, take note, degeneration. So the neurons here are being degenerated. If you are to remember, guys, as what was stated before, most of our cells in the body are able to regenerate except for that of our neurons. Neurons here, once destroyed, will be ultimately destroyed and will not be again regenerated unless stem cell therapy is applied. So in order for us to counter Alzheimer's disease and to somehow stop its progress or to slow down its progress, we're going to make use of stem cell therapy. The stem cells here will be once again implanted through administration by injection or through a certain surgery, in which, guys, it will stop the brain from dying. It will stop the neurons from that of dying itself. And eventually, guys, it will also stimulate the functions of existing cells, such in a form of compensation. So existing cells here will be again stimulated to compensate work and work double time, because most of the members of the neuronal complex has been already destroyed. So in this case, guys, while you are still regrowing all other cells or all other tissues of the brain, there is also stimulation of increased compensation from the remaining normal cells which are still existing. A recent clinical trial, which is still in phase 1, has shown that this approach to be of some benefit to patients with Alzheimer's disease by slowing down the progression of the disease. But as of this moment, because the brain here is a certain very splendid thing, if you are to remember, the brain here is sometimes very difficult to understand, and even the complexes that are utilized as medications for brain problems may still be ineffective in a way. That's the reason why still it is being studied, but it was found out during the phase 1 study with the use of stem cell therapy, it can be slowed down. Let's say, for example, from the time of diagnosis, a person with Alzheimer's usually will have complete loss of brain or neuronal function 2 years right after that specific diagnosis. But in this case, guys, instead of 2 years, it can be somehow lengthened up to 5 to 10 years, or even be stopped nowhere in the person in that specific time frame can still think properly. Remember, guys, Alzheimer's is very, very common in the elderly, specifically those that are beyond line of 7 or age, which is again on the 7th decade of their lives. So in this case, guys, this can be somehow slowed down, and that person still has a way to communicate with his family, and of course, has a way to somehow remember things, and of course, reminisce things that are again very important to his or her life. That's why then, if I will be asked someday, I would like to die, let's say, for example, in an age of 65 to 70, it's okay with me na as long as I still have this functioning brain power, because it is really very difficult, because I have a certain I have a grandmother before who have suffered from Alzheimer's, and during her last days, actually, she was not able to remember anything. She is acting as if she's still a child, and really, you're going back to that of your childhood, let's say, childhood knowledge, and of course, childhood, ano kaya siya, ang term natin di siya, childhood knowledge, or of course, childhood na outlook in life. So somehow you will be able to forget everything, even your children, and also, guys, even your loved ones. So in this case, really, when it comes to that of Alzheimer's, this will be a great advent when it comes to that of ano kayo, nawawala ako. When it comes kasi may Alzheimer's na. When it comes to that of treating this disease, and of course addressing this disease, and of course, guys, when it comes to that of stopping the progress of this disease. So it will give quality life to the patient himself or herself. Okay, let us now continue with that of the next one. So as you can see here, guys, we have a certain picture that shows a certain example of your Alzheimer's brain. And in this brain, guys, you will have neurons here, or the brain cell, which is again considered as damaged or degenerated due to that of the presence of amyloid plaques. If you are to remember, amyloid is considered as an abnormal protein in our body that when deposited into different body sites will also somehow correlate with that specific organ dysfunction. In this case, it is deposited in the brain and causes Alzheimer's. For the information of everyone, we have here, guys, the characteristic appearance for normal neurofibrils, and of course the tangled Alzheimer's neurofibrillary or fibrillary areas. And in this case, guys, you will see that specific transport of your, let's say, for example, senses, or of course sensory information, and of course the processing of that sensory information, and of course the effector release of that specific response is now halted, or of course damaged, or of course, guys, stopped due to that of the Alzheimer's disease itself. So remember, this is what happens in such case when one is suffering from Alzheimer's. And guys, when it comes to that of stem cell therapy, this type of Alzheimer's neurofibrillary tangles will be reverted back into a normal neurofibril status. Thus, also, guys, regenerating that specific neuronal cell and eventually giving much more memory and prowess to the person who is once again suffering from Alzheimer's brain disease, or of course Alzheimer's disease. If you are to remember, it will once again retain the quality of life. Okay, when it comes to that stem cells are also very, very important when it comes to that of drug testing. Guys, when it comes to that of drug testing, we are not referring to that of drug testing in order to assess if you are making use of heroin or any other type of marijuana or methamphetamine. In this case, guys, when it comes to the drug testing, it talks about the application of stem cells in the development of a new drug. Let's say, for example, a certain cancer drug or a certain metabolic disease drug. Stem cells could allow scientists to test new drugs using human cell lines, which could speed up the new drug development. Wherein, guys, let's say, for example, instead of making use of, let's say, we have here, guys, clinical trials, they're going to make use of stem cell lines that are again simulating that human tissue, that human organ. So instead of using the actual person that will be the subject of that drug medication effect in a 5-year, 10-year, or 20-year span, guys, they make use of cells. So with the use of these cells that are also simulating the person's own cell, this will determine if that specific type of drug is cytotoxic, if that specific type of drug is enterotoxic, if that specific type of drug is nephrotoxic, if that specific type of drug is hepatotoxic. Remember, when it comes to that of toxicity, we have here the minimum toxic concentration and the minimum effective concentration. So remember, guys, in your pharmacology, you have studied that when it comes to that of the development of a drug, this drug must be once again tested in animals, tested in humans, and must have undergone several phases of trials before it is to be released. In this case, with the use of your new stem cells here, the stem cell lines which simulate, ginasunod nyo again, the actual cell of that specific organ, or let's say of that organism, guys, with the use of stem cell therapy, with the use of stem cell lines, instead of making use of the actual human cell, guys, because they simulate, they're very much similar, identical, or the same with that of the person's own cells, we can see automatically what will happen to that of the hepatic cell, what will happen to that of the neuron, what will happen to that of the alveoli. Let us now continue with that in the next one. Only drugs that were safe and had beneficial effects in cell line testing would graduate to whole animal or human testing. Bongga siya. So somehow, this will somehow prevent, let's say, for example, too much of hypersensitivity reactions, or of course, we have here side effects. Because if you are to remember, this has been somehow tested before it was tested for animal and human testing. Of course, we can never deny the fact that we still need human testing. Kinanglan, gina-guys ang human testing because you need to somehow assess if that specific drug has a certain long-term effect, or that effect that will show pa right after 5 years, 10 years. And if you are to remember, guys, this will also somehow give them a certain idea if this drug can be carcinogenic. For the information of everyone, the test for carcinogenicity, that specific ability to cause cancer, is not usually seen. Take note, is not usually seen right after the first few months of treatment, right after the first few years of treatment. Usually, it can be seen after 10 years, after 20 years. That's why for some of the medications, those which were patented that we are using right now, up to this moment, they are still monitoring those subjects if they have developed mutation in a certain controlled environment. So which means if you are the subject, you will be again placed in a certain environment that will be again somehow controlled in an external and internal manner, so that they will assess if indeed your mutation, if ever in the future you will form a certain mutation that leads to cancer, may be associated with a drug or any other factors. That's why each and every factor must be completely isolated and of course completely analyzed to somehow negate the probability of the drug causing the mutation or causing the disease. Remember, drugs can be mutagenic and carcinogenic. Next one, guys, as what was stated, because of stem cells here, the usage of stem cell lines, it would allow quicker and safer development of new drugs. So quicker because, again, we can already assess which is, again, that specific cell usually affected by this type of medication and what cells are resistant to such. And of course, guys, knowing that they pass this trial with the use of stem cells that simulate the person's own stem cells, animal and human testing would progress eventually and rapidly as that of the usual traditional methods. Okay? Now let's now continue with that with the next one. We have here stem cells act as progenitor cells. If you are to remember, I already told you about this one before. Progenitor cells, which can either be, remember guys, no, can either be common myeloid or common lymphoid. In adult organisms, stem cells and progenitor cells act as a repair system for that of the body, for replenishing specialized cells which are also functioning differently. But also, they maintain the normal turnover of regenerative organs such as blood, skin, or intestinal tissues. If you are to remember, once again, these cells are multipotent because they come from the adult. And for the information of everyone, they are progenitor. When we speak of progenitor, they are set of cells that will develop into other differentiated cells that will function according to what they are differentiated for. So they act as a repair system, very, very much common in a certain process known as mitosis. That's why normal cells do tend to have this specific process known as mitosis, because as they somehow differentiate, as they grow, as they will divide into other cells, guys, they will tend to somehow increase the number of cells and at the same time increase that function of the number of cells. And eventually, guys, no, as it progresses into its lifespan, it may now differentiate according to what it is coded for. So this will replenish the specialized cell. And aside from that, it will also try to maintain the normal turnover of regenerative organs such as blood, skin, and of course, intestinal tissues. For the information of everyone, the skin is a regenerative type of organ. So it continuously sloughs off. And of course, if you are to remember, guys, there is the usual desquamation. But for the information of everyone, what is the reason why, even though we slough off every day, our skin slough off every day, still our skin remains intact? It is because of the fact, guys, that this skin cell, the adult skin cell, has a regenerative power that will continuously maintain that normal amount of cells that are being desquamated and normal amount of cells that are again formed in your dermis. For the information of everyone, also in our intestinal cells, do you know, intestinal mucosa also sheds every day as you remove those waste products, as you defecate, guys, together with that of your defecation, which is approximately 80%, take note at the bulk of a certain bacteria. For the information of everyone, some cells can also be found. They are desquamated cells from the intestinal or from the intestinal area, or from that of your intestinal lumen, which continuously grow and grow, because just like the skin, they need to be shed off to remove all other, let's say, toxins or even some of those unwanted elements in our body. Next one, guys, if you are to remember the blood itself, we must maintain a specific volume. Let's say, for example, 5 to 6 liters of blood, no? And such type of regeneration here happens with the process of, if you are to remember, erythropoiesis. Next one, we have here, guys, your megakaryopoiesis. Okay, and of course, guys, your leukopoiesis. If you are to remember, guys, when it comes to that of erythropoiesis, we have here RBCs. When it comes to that of your megakaryopoiesis, we're talking about platelets. And when it comes to that of leukopoiesis, we have here, guys, of course, your WBCs. So remember, these specific poetic functions are again achieved with the use of progenitor cells, which are again stem cells taken from different body sites of an adult if it's an adult stem cell. And remember, they tend to reform and reform all other cells with a process known as mitosis, because they are all diploid in characteristic except the gametes. And eventually, guys, know they will differentiate because some of them may still be precursor cells. If you have to remember, progenitor cells, common lymphoid and common myeloid, and some may have precursor cells. For example, okay, I'm just going to somehow cite this one. For example, for our RBCs, for mature RBCs, no, the precursor cells are nucleated RBCs. If you are to remember, no, nucleated RBCs. If you are to recall, the rubriblasts, guys, please take note, the rubriblast, the prorubricide, the metarubricide, and of course, the first part of the series that is considered as non-nucleated with exclusion of the nucleus, that is again your, yes, reticulocyte. So they are the precursors, the nucleated RBCs. If you are to remember, guys, your rubriblast, okay, Next one, your pro-rubricide. Remember niyo pa ni guys? Okay, next one, your rubricide. Okay, next one, if you are to remember meta-rubricide. Remember now, if you can still recall the last stage that is supposed to be nucleated is none other than your metanucleoside, because this time, guys, your reticulocyte is considered as that specific cell that is the first line in the series of RBC, which is considered as non-nucleated, but still it is not mature because we have here the mature RBCs as the final form that is able to once again, guys, properly and completely carry oxygen through its hemoglobin molecule. So take note of that information, guys. We have here for our RBC precursors. What about our megakaryocyte? Okay, if you are to remember, of course, megakaryocyte here, megakaryocyte is considered as the precursor. The precursor for what specific mature cell? The platelet. So if you will be asked, what is our precursor for that of platelets? The correct answer is megakaryocyte. But actually, no, it is megakaryoblast. Okay, next one we have here your pro-megakaryocyte, megakaryocyte, meta-megakaryocyte, and then platelets. Okay? And of course, guys, last but not the least for our WBCs, ano po ang ating precursors for WBCs? Okay, so let's have this one here for our WBCs. If you are to recall, we have here, guys, your myeloblast. Okay, specifically yung neutrophils. Okay, we have here myeloblast. Next one, guys, we have here your promyelocyte. Next one, we have here your myelocyte. Okay, remember niyo ba to? Next one, guys, we have here your metamyelocyte. And of course, the band cell. So this time, guys, we have here your neutrophils. Okay, so take note for WBC. Example, neutrophils, myeloblast, of course, kung lymphocyte, lymphoblast na siya, promyelocyte, myelocyte, metamyelocyte, band, and neutrophils. So remember those information, they are considered as the precursors, which means before we're going to reach the actual mature differentiated form, they are considered as the precursors, okay, before reaching the final differentiated stage. Let us now continue with that of the next one. So we have here, guys, for our history of your animal cloning. This one is actually, guys, more of trivial na lang. Since then, animals, including mice in 1998, cows in 1998 also, pigs in 2000, and cats in 2001, together with that rabbits in 2002 were successfully cloned. Imagine, no? They were able to clone such animals. Remember, when it comes to that of gene therapy and of course cloning, they may be somehow very much associated with one another. So the first one pala was your mice here around 1998, then cows also around 1998, your pigs followed by cats in 2000 and 2001 respectively, and rabbits in 2002. All of these animals were successfully cloned. Okay, so how successful was animal cloning? Guys, for the information of everyone, it's very low. It's only 1 to 3%. Imagine. The most famous of all is Dolly the sheep. For the information of everyone, Dolly the sheep has been very much well known during that time wherein, guys, it was again a certain national or international news grid that they were able to clone a certain sheep, and she was named as Dolly the sheep. But guys, according to that of that specific statistics, one live birth only out of the 29 cloned embryos was once again achieved for Dolly the sheep here to somehow be born. For the information of everyone, it is 3% in when it comes to that of the frequency, or when it comes to that of the success in cloning itself. For the cloned mice, 31 live births out of 2,468 cloned embryos. Imagine 1%. Next one, for cloned pigs, 5 live births out of 335 cloned embryos for 1%. That's why if you are to remember, cloning with the use of our totipotent stem cell may also be very low when it comes to chances, thereby killing most of the embryo, killing most of our laboratory embryos rather than that of forming a new individual. Clone goats, 3 live births out of 85, 3%. Yung pinakamataas lang, no? Clone cattle, 30 live births out of 496 cloned embryos, 6%. Clone cat, 1 live birth out of 87 embryos. And guys, cloned rabbits, 6 live births out of 371 of cloned embryos. But guess what have the scientists noticed when it comes to that of the clones? Guys, those clones here live shortly as compared to that of the source of such cell itself. Buod silingon guys, ang mga clones early pa nagkalamatay. So instead no of, let's say for example, this clone will live longer because this clone is healthier, this clone is again younger. But guys, as what they have somehow discovered, the source of the clone is still living while the clone died earlier. So maybe along the process there is a loophole, or along the process there may be a certain problem. Okay? Let us now continue with this one. First success of human embryo cloning. On February 12, 2004, South Korean scientists, di ba na-notice yung mag-inobis kan sa mga South Korean, wala na mga drama namin, mag-ilang mga doctors, Dr. Woo Suk Wang and Dr. Shin Young Moon, or Young Moon of Seoul National University, reported the successful creation of 30 cloned human embryos developed to the blastocyst stage and then destroyed by stem cell extraction. So, ginpa-blastocyst, ano nila, no? 3 to 5 days. Of course, usually, hamba nila ko, no? 4 or 5. Guys, and then this were destroyed by stem cell extraction. Of course, they're going to get only the inner cell mass, if you are to recall. So, the whole embryo is destroyed. And remember, that specific ethical implication, yielding one embryonic stem cell line. So they only yielded one embryonic stem cell line out of, if you are to remember, no, so many destroyed embryos. Okay, next one. So stores of stem cells for that of medical therapies. Tens of thousands of frozen embryos are routinely destroyed when couples finish their treatment. If you are to remember, when it comes to that of in vitro fertilization, there are so many embryos utilized. Frozen embryos which were extracted from donors or which were extracted from those people who donated their embryos for profit itself. This surplus of embryos can be used to produce stem cells. Regenerative medical research aims to develop these cells into new, healthy tissues to heal several types of illnesses. But for the information of everyone, there are so many, we may say, ang term natin dito, excess, or there is once again oversupply of the embryos. But actually, these embryos are routinely destroyed in the process of couple treatment, specifically when it comes to in vitro fertilization. So the excess embryo are actually being frozen and stored at a certain type of embryo bank, and of course it is at negative 85 degrees centigrade, and they will just be again taken out or of course stored before that specific testing. In whatsoever testing they will be applied. For the information of everyone, as what was stated, this may be a sin when it comes to that of the ethical issue or ethical side, specifically that those specific, let's say, embryos, as what was stated, are already living. Upon conception, they already have soul and life. That's the reason why it is still unacceptable in most Christian countries. But again, it is being utilized for regenerative medical research, which will aim to somehow develop these cells into new healthy tissue to heal several illnesses, as what we have stated just a while ago. So guys, we have here the different countries with a permissive or flexible policy on embryonic stem cell research. But for us here in the Philippines, it is mostly adult stem cell therapy. As you can see now, the Philippines is not yet associated with the map, which is associated with genomic sequence and the usage of stem cell therapy coming from embryonic stem cells. So we have here, guys, if you are to remember, our adult multipotent stem cells, which are usually taken from that of the bone marrow, which can be developed into all other types of cells. And remember, guys, no, its multipotency is again lesser as compared to that of the pluripotent type of cells. If you are to remember, greater than 200 cells for that of pluripotent stem cells, and for that of our, once again, guys, adult stem cells, which are multipotent, usually less than 50. But again, it can form the most common tissues, the liver tissue, the brain tissue. Next one, guys, the blood cells, even the fat cell, no? Pwede ganun siya. Next one, skeletal muscle cell, and of course, your epithelial cells, together with that of the neuron itself. Okay? Let us now continue with that of the next one. if you are to remember, guys, we have here the autologous stem cell therapy. Autologous comes from your own self. Guys, the peripheral stem cells can be obtained from drawn blood. So you will be giving your own blood, you will be donating your own blood, and from this blood of yours will be the source of your stem cells or adult stem cells. And of course, this will be implanted to you once again. While most blood stem cells reside in the bone marrow, a small number are present in the bloodstream. For some people, they tend to somehow, as what was stated here, prefer the usage of your adult bone marrow, the usage of the adult stem cells rather than that of the bone marrow because it is less stressful, less invasive, and of course without that specific necessity for anesthesia or general anesthesia. These multipotent peripheral blood stem cells or PBSCs, remember, we have here peripheral blood stem cells is also known as PBSCs if ever you will encounter this one in our exam, can be used just like bone marrow stem cells to treat leukemia, other cancers, and various blood disorders. As what I stated, it's autologous if it comes from you, and it is again allogenic if it comes from any other source. So we have here also some speculation when it comes to that of our stem cell medicine. Let's say, for example, we have here discarded in vitro fertilization embryos and they will be utilized as to that of the blastocyst stage. The inner cell mass is harvested and they will form the pluripotent stem cells. Next one, we have here, guys, the donated tissues, which is your brain tissue. Let's say, for example, this is, again, a certain tissue that comes from a person who died due to that of accident. And before that person died from accident, he or she actually affixed his or her signature for organ donation in whatsoever organ that is still functioning and, let's say, for example, still up to its optimum characteristic morphology and optimum functionality. Guys, this will be donated to all of those that need such type of, again, tissue. So what happens here? Tissue stem cells are said to be also donated in such case, and this can be multipotent because it's already coming from an adult individual. So these cells here can be the source of any other tissue. Let's say, for example, blood tissue, heart tissue, and muscle tissue. And this can be utilized for either transplantation or drug discovery. So the speculation when it comes to that of our stem cell therapy is this. It is again the collection of all the stem cells coming from embryonic stages or adult stages, and guys, can be developed into any other cell or cell line for transplantation and for drug discovery. So it's just once again the summary of what we have discussed just a while ago. So treatment now also becomes specific. Let's say, for example, we have here the patient-specific stem cell therapy. So we have here, guys, for that of biopsies. Remember, we have that specific type of cell that we need, specifically that we need to develop this type of cell only as differentiated cell. We're going to get the nucleus and it will be transferred. It's more of cloning now. And guys, what will happen here? There will be nuclear reprogramming, and of course, this will now form into a specific tissue. Of course, guys, no, as what was stated, a specific cell. Of course, in this type, guys, it is an embryonic cell stage in its blastocyst stage first. And of course, you're going to isolate and propagate the pluripotent stem cells and will be formed into different types of cells or tissues needed for transplantation to that of the person who is in need. So guys, this can be considered as a certain type of therapy that is specifically associated with the needs of the patient. So whatever is that specific need, if it's blood, if it's nerve, heart, or of course muscle, it will be implanted to the patient. It will regenerate in the patient and eventually heal whatever the patient is suffering from. So remember, guys, it is specific because we're going to get the cells first that we need, and we're going to implant that specific nucleus into a certain ovum, and it will form that characteristic blastocyst. And of course, blastocyst, the source of pluripotent stem cells, you know what happens next. Summary naman namin, guys, okay? Applications of stem cells. Okay, what are again the applications of stem cells here? The first one, cell replacement therapies. Cells could be stimulated to develop into specialized cells that represent renewable sources of cells and tissue for transplantation. You already know this one. It has been explained over and over again. Cell replacement therapy could treat injuries and various genetic and degenerative conditions, including muscular dystrophies. If you are to remember Duchenne type muscular dystrophy with the weakening of the muscles, and that specific child will undergo debilitating effects until such time that the child dies due to that of respiratory distress. Next one, guys, we also have here retinal degeneration. Remember, cornea and retina that has undergone degeneration can be regenerated. Alzheimer's disease and Parkinson's, even arthritis. For the information of everyone, adult stem cell therapy now is utilized for chronic arthritis treatment, for diabetes and spinal cord injuries and blood disorders such as hemophilia. Remember that specific problem when it comes to that of, yes, blood clotting. So this is associated with blood clotting deficiency. Let's say, for example, if it is, for example, guys, if it is hemophilia 1 or hemophilia, sorry, hemophilia A, which is again hemophilia 1 in some sources because it is the first hemophilia, is considered as a certain deficiency for coagulation factor 8. So guys, in this case, if you are deficient in coagulation factor 8, you are having a problem when it comes to the blood clotting. So the patient usually suffers from hemorrhage. Next one, guys, we also have here another one, hemophilia B. Hemophilia B or hemophilia 2 is considered as a deficiency in factor 9 for our coagulation factors. This is also referred to as Christmas disease. Next one, guys, we also have here, guys, for the last one, hemophilia C, which is factor 11 deficiency, which is also referred to as Rosenthal syndrome. For the information of everyone, they are again diseases associated with increased, guys, please take note, with increased bleeding due to that of a deficiency in coagulation factors. That's why it's a blood clotting deficiency. Guys, hemophilia A, also known as the classic or royal hemophilia, is considered as factor 8 deficiency. Hemophilia B, which is referred to as factor 9 deficiency or Christmas disease. And hemophilia C, factor 9 deficiency or Rosenthal disease. Okay, so take note of those information. Okay na po? Let us now continue with that to the next one. So we have here the positive uses of stem cell technology. So first one, your replaceability of the tissues or organs. So of course naman, no, we can replace tissues and of course we can replace organs. Repair of defective cell types, such as those cell types that are abnormal or neoplastic. Delivery of genetic therapies is also very easy, no, and very good when it comes to that of the delivery of genetic therapies. It can be inserted into a certain tissue, same tissue that contains that specific genetic mutation and will now be treated with new cells with normal DNA set. Delivery of chemotherapeutic agents. Remember, if they are similar or the same as tissues, and of course, guys, as they are having the same receptors, it can easily enter and of course drop that chemotherapeutic agent that will now be, again, not isolated and of course not removed from that of the system by your liver for that of liver or hepatic metabolism due to the first pass mechanism. If you are to remember, the delivery of chemotherapeutic agents with the use of stem cell therapy is much more effective than that of oral therapy and even than that of intravenous therapy. Okay? So we have here, guys, embryonic stem cells are unstable and they may also mutate in culture. This is one of our disadvantages aside from the ethical issues. Like ordinary cells, stem cells accumulate significant numbers of mutations over time, including several that could cause them to become tumors. So this may be the problem that we will encounter when it comes to that of the usage of stem cells. Guys, just like any other cells, they may undergo mutation. Therefore, sir, can we say that, let's say, for example, the patient that we have discussed just a while ago, who were treated for that, or who was treated rather for that of leukemia, may also still develop leukemia in the future? Yes, because remember, mutations are not usually seen at first hand. It may be seen after several months or several years pa. And this mutation can somehow be affecting our regular cell cycle and thereby can be tumorigenic or neoplastic in nature. Okay, so remember one of our disadvantages. Next one, ethical debate. You already know this one. Guys, harvesting embryonic stem cells destroys the blast cyst. This is considered as murder if you are to remember. Guys, your embryonic stem cell research requires human cells, and this could create a commercial market for human cells that will still be focused only in getting money or remuneration rather than that of maintaining life. So this will devalue life because if you are to remember, once there is life, there is again the Holy Spirit in that specific life. And of course, guys, that life needs to be valued and needs to somehow follow the usual trend and of course the usual activity of a human. But in this case, no, it devaluates life, it devalues life because of the fact, guys, that you are killing the individual before he or she is given the freedom to express his or her worship and praise to the Lord God. Okay? So, guys, destroying life to cure one is said to be ethical or not. So if stem cells have such potential to relieve suffering, why are so many people so upset about their use? The reason is that the most powerful type of stem cell, embryonic stem cells, can only be obtained from human embryos. And many people think that it's wrong to create and destroy human embryos to treat disease. So actually, this is the problem that we have right now because we act like God and we think that we are having this specific intelligence at par with God itself. So if I were to be asked, I will somehow, because we are in a Catholic Christian school, remember, I will somehow prefer the usage of adult stem cell rather than embryonic stem cells, no matter how powerful they are. So religious debate over harvesting embryonic stem cells. The pro-life group generally believes that personhood happens at or shortly after conception. So at conception, at that specific type of, we may say, union of the sperm and egg, there is already life, or even after conception, immediately after conception on the first day. Thus, they consider the removal of stem cells from an embryo, which is a procedure that kills the stem cells, to be a form of murder of a human being. So they argue that no potential health benefits to even hundreds of millions of people can justify the murder of other humans. If I were to be asked, this is not justified. Remember, guys, your good results will not be justified by good means. Okay, please take note, there is no justification in this part. Okay, so the pro-choice group generally believes that personhood is attained much later in pregnancy, perhaps when the fetal brain develops consciousness during the third trimester. So this is the pro-choice for that of stem cells. Kanina naman niya, pro-life. This one, pro-choice. They go to that of embryonic, or they go for that of embryonic stem cell therapy. So according to them, ang personhood, that specific knowledge about life, that specific knowledge about the probability of being able to be born, and of course that specific soul is only attained during the latter part of pregnancy, no, perhaps no, when the fetal brain has already developed, because it's talking about awareness. Thus, extracting stem cells from a 5 or 10-day-old pre-embryo is not murder. Killing a pre-embryo, which is only a potential human being, is justified if it has the potential to cure diseases and extend the lives of people. But again, for me, any activity that will once again devalue life itself and will imitate that of the activity of God is considered as immoral. For me lang yun, unethical. Okay? So we have here, guys, different ways in which a specific type of cloning could work. And actually, this has been discussed before naman. When it comes to that of cloning itself, guys, usually we are going to make use of the skin cell, specifically the nucleus coming from the skin cell. So we have here, guys, skin cell is taken from the patient's body and its nucleus contains the patient's genetic code. So we're going to get the nucleus, and of course, guys, now we're going to implant it in an unfertilized ovum or egg cell. Next one, guys, it will be electrocuted actually so that they will have that specific binding with one another. Of course, guys, no, it is again inserted through that electrocution, and eventually it will form a specific zygote. So remember, guys, first, remember, the skin cell here is the source of the genetic material or genetic information coming from the same human. And guys, this skin cell, which is again composed of its nucleus that contains all the genetic information, is characterizing the whole personhood of our source here. So what happens here, you're going to make use of the unfertilized egg cells nucleus. So what will happen here, guys, you're going to get first that specific nucleus. So inucleate mo siya, anay. So we now have here the nucleus coming from that of the egg cell, and of course the nucleus coming from that of the skin. Okay, so what will happen here now? Of course, please take note of this one. We're just going to make use of this part of the egg cell, the cytoplasm, or that specific type of cell or egg cell that is now enucleated. We're not going to make use of the nucleus coming from the egg cell because it characterizes the mother. This one is, again, the person that we need to clone. So we need to make use of the nucleus coming from this person. So this specific nucleus coming from the skin cell is the one that is being utilized from the donor. And of course, guys, the carrier here, or that specific vector, is the egg cell, which is again inoculated. When we speak of inoculated, gikakas nucleus. So these two will be once again electrocuted so that they will be that specific insertion. So insertion and binding between the nucleus coming from the skin cell and of course the cytoplasm, or the remaining structure of the enucleated egg cell, will now be formed through electrocution. So remember, this is now very similar with that of a zygote. So this will divide, creating different stem cells. And eventually, the stem cells would be grown in culture, and where they could be turned into specific tissue types such as heart or nerve cells. Next one, cultured tissue cells could then be injected into the patient, and new healthy cells would replace diseased or damaged body tissue, healing the patient. And remember, because it comes from the patient, it is 100% identical and no rejection. The patient's body wouldn't reject the cells because they would contain the patient's DNA. So this is what happens in cases when there is once again cloning of the human cell to form not the whole individual, but rather, guys, to form any other cell of desire in order to treat a certain present condition. Again, let's repeat for the last time. We're going to get that specific sample skin cell coming from the actual patient. But guys, only the nucleus of the skin cell will be utilized. So we're going to again discard that specific structure, of course, the cytoplasm and cell membrane. And eventually, guys, we're also going to make use of an egg cell because the egg cell here serves as the vector or the carrier of our skin cell nucleus that is, of course, composed of the genetic material to form that specific genes and, of course, sets of, we may say, information in a genome present from the patient himself. Next one, what happens here? We're going to enucleate first. When we speak of enucleate, kakson ang nucleus sang ato na ovum. And of course, guys, this specific nucleus here will be discarded, and we're just going to make use of the cell membrane and of course the inclusion cell membrane and the inclusion cytoplasm of that specific egg cell or ovum. And of course, guys, no, we're going to impregnate the nucleus into the ovum, and of course this will happen only with the use of electrocution. Just like with this specific type of, we may say, fusion, there will now be that growth of a zygote which will eventually divide, and we will now have stem cells. So the stem cells now will be grown in culture according to what they are needed for, and of course, guys, no, they will be injected to the person, and the person now will have healthy cells and will have the resolution of his disease. And of course, last for this one, shall be humans, or shall we clone humans? No, diba dapat shall we na siya. Arguments for and against human cloning research. Should we ban human cloning? And why are investors moving away from human cloning, and why human cloning now looks as a last century way to fight disease? Why some people want to clone themselves or even to clone the dead? These are actually questions that are said to be considered as left to be answered by, and we are still, let's say, for example, into a certain conspiracy theory only. We have not yet found the actual clone of one person and the actual discovery of the clone to serve as a certain source for organ harvesting. As of this moment, these are just, again, questions. Why are we not cloning humans? It may be associated with ethics, it may be associated with economy, it may be associated with that of conspiracy. So we don't know. So we have here, guys, our discussion for stem cells. Again, this will be uploaded today, Saturday. Tomorrow, your continuation for our review in cytogenetics. And if we still have time, guys, a little bit of hybridization. Overview lang of hybridization. And of course, for Tuesday, next meeting, we're going to have here, guys, our final discussion, which is introduction only to NAATs, or nucleic acid amplification tests. do tayo naman gid lang guys. Kaya may exam na kita by Friday. God bless you guys. Take care and study smart.